Hello there. I'm Melissa Cady, a board certified anesthesiologist and board certified pain medicine physician, and also the owner of Painless Wellness. You're watching this video to get an understanding of what to expect on the day of your procedure. Whether it's myself or a trusted colleague, one of us will speak with you virtually or by phone in some circumstances before the day of your procedure in order to review your medical issues and create a plan for your anesthesia in a less rushed and a more relaxed state. Please bring up your concerns during this visit. You will typically be informed by the surgery center within the week before and or up to the day before as to when you should arrive for your procedure, which typically is about 1 hour prior, but this can vary. They will review the policies for your day of your procedure and remind you of certain things to do or not to do, including not eating at least 8 hours prior to your procedure. However, if you're on any medications that slow your gut, such as Ozempic, Mounjaro, etc., or have any medical issues that could slow your gut like diabetes, you may be told to hold solid foods longer. When you arrive to the surgery center, you will be taken back to a preoperative room where a nurse will measure your vital signs and sign consent forms, if you have not done so already. You may also be asked to give a urine sample to assess if you have tobacco in your system and or if you are a pregnant female. If those items are not positive, then they will have you change into a gown. You may also be asked to take a couple of pills such as Tylenol and or gabapentin with a couple sips of water. You will typically have your IV placed by a nurse in the preoperative area, but feel free to discuss any concerns you may have, whether it's related to arm restrictions or struggles you've had with getting an IV in the past. At some point, you will get to meet your surgeon to ask any last minute questions or to receive any markings or pictures that the surgeon may like to do. Also, prior to going back to the operating room, you'll be seen briefly by your anesthesiologist to verify a few things and to see if there are any last minute questions. When everyone has confirmed they are ready for you, then you will walk with the nurse and or your anesthesia provider to the operating room and be guided to lie down on the bed. At that point, your anesthesia professional will give you some relaxing medicine if you'd like to help calm your nervous system just before placing all of your safety monitors and giving you some oxygen gently by face mask. Once we are happy with the setup, then your anesthesia provider will proceed to give you additional medication called propofol to induce a very deep sleep and place a small breathing tube through your mouth and between your vocal cords. Placing a breathing tube is typically necessary to optimize the situation for the surgeon's work and also to reassure us that you are breathing without issues and minimize the risk of aspiration in the event that your stomach acid passively moves into your throat area. Your anesthesia professional has access to using a special video scope to see your anatomy more clearly to place that breathing tube. There is always going to be some risk of irritating tissues anywhere from the lips down to the vocal cords. However, we take great care to minimize those things. Most of these inconveniences resolve on their own over days to weeks. It is extremely rare to have serious complications. We will maintain your general anesthesia with IV and or gas or volatile anesthetics, anesthesia. General anesthesia means you'll be unconscious during your surgery. This is not a twilight anesthesia situation, as this is planned to keep you unaware at all times during your surgery. It is very normal to be groggy that day and sometimes the next day. However, the mental effects can come from medications you take after your surgery as well. When surgery is done, you will typically wake up with special bandaging based on your procedures. So, for anyone having a rhinoplasty, you will have some bandaging on your nose, maybe some splints in your nostrils, and a drip pad under your nose. The back of the throat can be irritated additionally from some postnasal drainage and or blood. If you have a rib graft harvested from your chest area, then you will have a bandage over that incision site as well. For anyone having a facelift, you'll wake up with some bandaging wrapped around your head. If you're having a blepharoplasty or any upper or lower eye work, then you will receive eye ointment, which can create some blurry vision initially. Your surgeon will use local anesthesia to minimize the need that day for a lot of long-acting opioids, which are known to cause nausea, severe constipation, and urinary retention. Irregardless, your anesthesia provider will be giving you 2 to 4 different anti-nausea medications in your IV prior to you waking up from anesthesia. Most patients do not have nausea from the medications given during their anesthetic. If you have severe motion sickness while in the front seat of a car, please let your anesthesiologist know, as there is a scopolamine patch that can be considered as part of your anesthesia plan ahead of time. If your surgery is greater than 3 hours, then please know that you will likely have a catheter placed in a sterile fashion to the bladder by the operating room nurse after you are asleep. However, this will be removed before you wake up. If you have any issues with urinating on the night of surgery, please let your surgeon know. Our goal is to keep you safe on a day that many patients are understandably nervous. Please let us know if you have any particular concerns or questions during your anesthesia consultation. Thank you.